Is your child getting all the nutrients they need to grow and thrive? It's a question that keeps many parents up at night. But fear not, because today we're going to talk about malnutrition in children and how to recognize it. Malnutrition is a significant concern. It can affect a child's physical and mental development. But how can you tell if your child is malnourished? First, look at their overall growth. Are they gaining weight at a slower pace than their peers? Is their height not up to the standard for their age? These could be early signs of malnutrition. Next, consider their eating habits. If your child is often uninterested in food or eats very little, it could be a sign that they're not getting the nutrients they need. A decrease in immunity could also be a telltale sign. If your child frequently falls sick or suffers from infections like upper respiratory tract infections or diarrhea, it could be due to malnutrition. Constant tiredness and lethargy can also signal malnutrition. If your child always seems tired, lacks energy, and is not active, it's a cause for concern. Lastly, changes in behavior can be a sign too. If your child becomes irritable, uncomfortable, or cries frequently, it could be due to a lack of necessary nutrients. Specific deficiency signs can vary depending on the nutrient that's lacking. For example, iron deficiency can lead to pale skin, brittle nails, and constant fatigue. Iodine deficiency can cause stunted growth and intellectual delays. Lack of vitamin A can lead to dry eyes and an increased risk of eye infections. Vitamin D deficiency can result in soft, deformed bones and delayed tooth eruption. And a lack of vitamin B1 can cause fatigue, loss of appetite, and numbness in the hands and feet. So why might a child become malnourished? It could be due to an unbalanced diet lacking variety, poor absorption due to digestive issues, increased nutrient needs during rapid growth phases, or chronic illnesses that increase energy needs and decrease absorption. What should you do if you notice these signs in your child? Seek medical advice. A doctor can provide a proper diagnosis and suggest a suitable nutrition plan. Ensure your child's diet is rich in iron, calcium, vitamins, and other nutrients. Make their meals more appealing and diverse to stimulate their appetite. And if there's an underlying illness, make sure it's treated properly to improve your child's overall health. Remember, diagnosing malnutrition should be done by a medical professional. Don't supplement any vitamins or minerals without a doctor's prescription. A balanced and varied diet is the best way to prevent malnutrition. To sum up, recognizing and dealing with malnutrition involves monitoring your child's growth, eating habits, immunity, energy levels, and behavior. If you spot any signs of malnutrition, seek medical advice, ensure a nutrient-rich diet, and treat any underlying illnesses. Prevention is always better than cure, and a balanced diet is the best preventative measure.